Hi, my name is Betsaida Fernandez, and today I will be showing you all how to insert a catheter in a male patient. So the first thing I want to do is get my patient's chart and review their physical limitations, as well as gathering all of my supplies. Once done that, I will perform hand hygiene and put on any personal protective equipment that's necessary. So, first thing I'm going to do is go into the room and identify the patient. So.
Yes.
Hi, my name is Betsaida and I will be your student nurse today. I will be inserting a Foley catheter today, so there will be some discomfort in that, and it will be a pretty involved procedure, so if you could please let me know whether you need my help or if you can help me while I'm performing the procedure. Is that okay?
Yes, ma'am.
All right. So let me just give you a little bit of privacy. And just to be sure, can I check your ID band? Okay. Your first and last name?
Joshua Johnson.
Okay. And your date of birth?
05/03/1929.
Okay. Thank you, Joshua. Is there anything specific you'd like me to refer to you as?
Joshua's fine.
Joshua? Okay. All right, Joshua. So, the first thing we're going to do is I'm going to put on my gloves. I brought a few cleaning supplies with me, so just allow me very quickly to adjust your bed, and I would adjust the bed to a comfortable working height and a comfortable position for the patient. Is your neck fine? Are you comfortable?
Yes.
Okay, so the first thing I want to do is put a pad underneath you just to catch any liquids that may fall on the bed. Now, are you able to help me?
Yes.
All right. And just let me know up to what extent you can. We don't want to strain. Okay? So, I'm going to just turn you just a bit. We're going to put this right underneath. Okay? And you can turn right back over. And I will put it right there. Okay. Perfect. Perfect. All right. Looks good. Okay, now if you could just help me a little bit by scooching over to the edge, just so that I can get to you a little easier. Okay, and can you please just spread your legs just a bit wider than your shoulders, just a bit. No need to no need to be that wide. Don't want to hurt yourself. So, all right, I'm just going to expose you just a bit. Please let me know if at all you feel uncomfortable or you feel any pain. I'm just gonna put this towel over you just to, give you a little more privacy. And I have my bath towels, my bath wipes, to just clean the patient's genital area. Okay. I'm just going to expose you just a bit, as far as needed. Okay. And I will grab the shaft of the penis with my left hand and start at the tip, and just clean in round, circular motion. Okay. Now we'll grab another one and clean downward. Okay. Thank you. All good?
Yes.
Feeling a little cold. Let me just cover you right back up. Okay. Now that we're done giving the patient's genital area a good cleaning, I'm going to remove my gloves, perform hand hygiene, and I will start with just getting my catheterization tray, which is pre-packaged, making sure that it's not expired, open, or damaged. I also did bring in with me a syringe and some tape to secure the Foley catheter. Okay. I'm just going to take this out of the packaging. Okay. And I'm going to open the flap, making sure that I am not contaminating because this is my sterile field now. And the outer edges, pulling them outward, and also grabbing this flap. Okay. And adjusting it as necessary. Okay, now that we have opened our sterile field and have not contaminated, first thing I'm going to grab is my sterile gloves, put them on another part of the table that is clear and clean, and open them. Now I'm donning my sterile gloves. And adjusting as necessary. Okay. I could just discard of this. Okay. For this procedure, I will need the padding with the incision through the middle. Okay. Okay. That one we will use in a bit. So, what I would like to ask of you right now is if you could please lift the towel and assist me with your grabbing your private area. Okay. Thank you. Okay, now that we have that there, if you would please re-spread your legs. And I will be putting this raw sheet right underneath. And if you would so please as to lift your hips so that I can put this straw sheet underneath you. Thank you. Good. Thank you. I will also put this right underneath, so if you could please keep your knees up. Now that we have our sterile field in place, I can move my equipment to the bed. Okay. So, at this point, I want to make sure that I have all my things together. And we did see from the patient's chart that they are not allergic to iodine, so we will be using the iodine solution in this case. And I will just be preparing everything right now. Just putting the iodine on the cotton balls and soaking them up. Put this on my sterile spice. Okay. Now that we have that, I will get a bit of lubricating jelly. Putting that on the tray. No longer need this. Okay. We have our tongs ready. And now just to grab the Foley. Now we want to make sure that the Foley does inflate and the bubble does form so that we don't have to stick in and remove the Foley from the patient's urethra. Okay, and it does inflate, so we're all good to proceed with the procedure. I'll leave that there prepared. This. And at this point, I would also want to lubricate the tip of the Foley catheter for smooth entrance. And leave it on the side. Okay. So with my forceps, I will grab the cotton ball and now this will remain as my clean hand and this my sterile hand as I'm continuing with the procedure. Okay, my clean hand will now go on the patient's shaft, and I will begin to put the iodine cotton ball around the top, moving in a circular motion downward. Okay. Getting another, and going downward in the shaft. Okay. Okay, now that we have that there, I will grab my entire package here Is it okay if I set this bag on you?
Yes.
Okay. Thank you. Okay. And what I will do is ask the patient to take deep breaths as I stick the tip of the catheter into the tip of the penis into the urethra. So if you could please take deep breaths. It will be uncomfortable, but I want to make this as quick and painless as possible. Okay. Okay. Now that it is in far enough that we reach the bladder, then I will inflate the balloon. Okay. Catheter has been successfully put in to the bladder. If you could so please as to hold your genital area for me. Thank you. And now that that procedure has been completed, I will get a few pieces of tape and secure the Foley. Now, depending on the facility, I will be using a catheter holder or whatever the facility requires you to have. Okay, now that this procedure is no longer sterile, I can remove everything. Just going to get this. Okay, and I can remove everything else. If I needed to collect the sample, I could simply take the sample from the urinary bag, and I would attach it to the bed hooks. Okay. And the procedure is complete. Now, if you could please lift your legs, I could just take these out from underneath you. Thank you. Okay, feeling all good?
Yes.
All right, thank you. Let me just remove these items for you. If you could please lift your hips for me just a bit. Okay. I would remove my gloves. And perform hand hygiene. Of course, you would want to come check on the patient per facility policy. And that is all. Thank you.